jasuma rieko mar elimu bora working group Boaz Waruku kotudore kod chal mar some pacho kae. Kata kamano kapok wadhi mbele kod twak mar okinyi ma kawuono dago mar mondo mi wawinjane gino matimore e romo madhi mbele ahinya nyato mano mobagi mar sumo rieko kata mar twak kotudore kod okumba manyien mar Thieth mano mar Social Health Authority manyaka sani osebedo kod ng'ikruok makoni kod kocha. Jafwambo mar Judith Omondi nitiere kuro luonwa twak makamano achiel kachiel kata kamano wawinjane ng'ama loso kuro gi sani.
Beating this much money, how do we make sure that that money can also serve our HIV patients? I think it wasn't factored in, but we have been jolted by these stop work orders, and we must do something about it. There is no way we're just going to move ahead with business as usual. Thank you.
Okay, before Dr. Rugo speaks, I want you to think about this question. What do you, do we need to think about going back to what was and improving it, or how do we move forward? That will be the next question. So Abraham, go ahead.
Thank you. First of all, there's no bullet answer in terms of how we move forward. In terms of what are our options in the earlier question that you had asked, you know, what do we do? I think first of all, my deepest sympathies. I'm also in an organization that has been affected. One of our projects was we were redesigning the day before, then the next day we were getting a letter to say it's over. But with that sympathy, I think this particular opportunity that we have is, and allow me just to go a bit more into the budgets. When you look the way we have structured our budgets, so you have a Ministry of Health at the national level, then you have the county governments, the 47 of them. One of the things that we have been pushing for is that it's time for us to do a fairly difficult task, and I think team has been trying to help us unpack it a bit. What really do we need to spend on when we talk about healthcare? That's one. Because a lot of the healthcare that we talk about are the claims at facilities, by facilities. In other words, who is purchasing for you? But do we factor in the other determinants of healthcare and how we are spending on them and efficiently? For instance, clean water sorts out a huge component of your health-seeking activities. Because it's about diarrhea, it's about typhoid. A lot of them are water-related. And perhaps, as people who work in healthcare, we need to start worrying a bit more and pushing that our advocacy for budgets needs to be about clean water and access.
Ramogi juanga mago jokanyoma nitiere sector mar Thieth mano Health NGOs Network mago jokanyoma nitiere sector mag Thieth mago maga maok mag piny owacho ka koro gichwalo paro mag gimopogore kotudore kod okumba manyien mar Thieth mano mar Social Health Authority manyaka sani osebedo kod ng'ikruok mopogore nyaka sani koro giwacho ni nitiere moko kuom fundi manitiere Social Health Authority ma od bure manyaka koro loke ahinya nyato mago ma osebedo ka chwalo omenda mago mag chronic illness kata chronic diseases makoro giwacho kanyo ni chronic illness ka achiel kod primary funds gin moko ma onego bedni ichwalo kod od bura. Jafwambo marwa Judith Omondi nitiere romo makamano matimore City Hall bore Nairobi ka kendo biro bedo ka omiyo matut e weche manyien duto mag odiochieng' makawuono. Ramogi juanga ng'isi ni e chenro ni mar mbako romo odiochieng' makawuono jafwambo wadwa mano Sharon Ong'ao entiere ground entiere kod jopuonjre manitiere e mbalariany mano mar UON bore Nairobi ka kama en bende dwa goyo kod